Welcome to this segment of EHR Institute's InTech Brief, where we bring you up-to-date news that affects today's EHR professionals. I'm Jeffrey Erb, your host of the show. The big news of the week is that CMS unveiled its new website on meaningful use incentives. The site is intended to help healthcare providers better understand the criteria to meet federal requirements for the meaningful use of electronic health record systems. As we've reported in the past, under the 2009 Federal Economic Stimulus Package, healthcare providers who demonstrate meaningful use of EHRs will qualify for Medicare and Medicaid incentive payments. Visitors to the new site can download fact sheets detailing the proposed program requirements and the proposed definition of meaningful use. The site also clarifies various terms, such as eligible professional and certification, that are included in the HITECH Act. You can visit the site by visiting www.cms.gov/EHR incentive programs. Also in the news, electronic health records certified under a new temporary certification program outlined by the government are expected to be on the market by fall, the nation's health IT chief said Friday. Certification is a critical piece to providing meaningful use for hospitals and physician practices to be eligible for Medicare and Medicaid incentives under the ARRA, said David Blumenthal, National Coordinator for Health Information Technology. He went on to say that this is a very technical regulation, but it is absolutely pivotal to our long-term goal of creating an environment in which providers can, with confidence, acquire electronic health records and realize their full benefits for the American people. Certification was part and parcel of the process of making incentives work and making the electronic health system work, he added. Certification provides a basic guarantee to the purchasers, mostly providers of care, that the electronic health record they purchase will be capable of meaningful use. Blumenthal spoke June 18th on a news conference call, the same day the final rule for temporary certification was slated for publication in the Federal Register. The rule specifies how the products will be certified. The temporary certification program for electronic health records and EHR modules is to serve as a bridge to the second permanent certification. A second rule in the permanent process will be coming later this year, said Blumenthal. The Wall Street Journal reports that a Harris Interactive Health Day poll of more than 2,000 adults finds the vast majority are not using electronic tools to communicate with their doctors. Only 7% report using an electronic health record to capture medical information, while 9% say they use email to communicate with a doctor and 8% schedule medical appointments online. In addition, 42% do not know if their primary care doc uses electronic medical records for visits or treatments. They have a general idea that an electronic medical record, described through those polls as a virtual health history, would be valuable. 71% of those polled strongly or somewhat agree with that notion. They're less keen on sharing. More than half strongly or somewhat agree with the idea that health records are for their own use and should not be provided to other parties. But 78% agree that all physicians treating them should have access to information contained in their EMR. Yet that generous spirit stops with insurers. Only 30% of those polled somewhat or strongly agree those companies should be able to access EMR information. Finally, a recent article by Gianna Shaw for Health Leaders Media demonstrates that the iPads are already becoming an invaluable tool for healthcare workers. When asked what the one technology is that they can't live without, a majority of the responses reference the iPad. D. Ellen Smix, MD, Medical Director of Fertility Partnership in St. Louis, Missouri, said that originally he thought it would be mostly used for fun, but that really it's turned into an invaluable work tool. He now has all of his online medical journals and medical search engines at his fingertips at any time of the day. His iPad seamlessly interfaces with his electronic medical record system, which he feels increases accuracy in everything he does. Even more important, the device has helped him overcome a condition common to physicians: poor handwriting. Using the iPad and a dictation software application, he says he dictates everything from case notes to patient letters. The practice's marketing department also uses iPads. They can build presentations and PowerPoints, which can instantly be showcased out in the field. The iPhone has brought a little fun to the Indianapolis offices of Downtown Physical Therapy, says Bryce Taylor, president of the practice. He said that nobody could have convinced him 3 years ago that his patients would be playing video games for treatment. Yet now, the iPhone has helped his patients complete home exercise programs. One application has a printer-friendly handout function he uses to show patients the exercises. The smartphone is the new doctor's black bag, says John Luo, MD, Associate Director of Psychiatric Residency Training at the Resnick Neuropsychiatric Hospital at UCLA Medical Center. He says he never leaves home or office without it. Luo uses his phone to check medication dosages, the drug interactions, sends refills online, and looks up all sorts of medical information using the web browser. He lists about half a dozen applications that provide him with health information, continuing medical education, and medical calculations, all at the point of care. He says that the smartphone is more valuable than a computer because it is always available to help. Well, that's all for this segment of EHR Institute's InTech Brief. Don't forget to visit us online and interact with your peers involved in EHR at www.ehrinstitute.org. Thank you very much.